Hello and welcome to Below the Hospital, an AAMI podcast on sterile processing and the issues that sterile processing technicians face today. I am your host, Garland Grisby, Interim Assistant Director for Sterile Processing at Kaiser Permanente, and also the Endoscope Service Manager for Kaiser Permanente. I'm also a longstanding AAMI member. Now, in this podcast, I interview folks from around the industry about sterile processing and ask hard questions about how we can uplift the profession and protect our patients. Today, I have the pleasure of speaking with Atila Nozari, and he's a PhD and is a senior medical liaison at Solventum. Now, just a little bit before I allow him to go deeper into what he does and who he is, he has more than 2 decades of experience in medical device reprocessing, scientific affairs, and standards development with CSA, ISO, and AAMI. And he's currently co-chair for AAMI Standards Working Group 12, Instruction for Reusable Device Reprocessing Working Group. Now, so Atila, let's get started with some basics. Just some questions that a lot of folks don't know that are in the industry, that are reprocessors, that are sterile processing professionals. They don't understand who produces IFUs and how are they relevant to sterile processing professionals? And you can take that in 2 parts. So who produces IFUs?
Hello, Garland. So let me start by thanking so much for inviting me. So I'm excited to be here today and to have this opportunity to connect with you and your listeners. And that's very important for me. So good question, 2 parts basically. So who produces? So instruction for use, or IFUs, they are produced by medical device manufacturers as part of the regulatory requirement. So regulatory requirements make sure that they ensure safe and effective use of the products. These documents typically provide detailed instructions for handling, operating, cleaning, sterilizing, storing, and maintaining medical devices used in healthcare settings. The FDA's Quality System Regulation, QSR, specifically requires manufacturer to establish and maintain procedures for device design, production, installation, and servicing, which includes also providing the IFUs to the end user. So for the second part of it, right, how is it relevant to the sterile processing professionals, to our SPDs? So instruction for use are essential because they guide the proper reprocessing of medical devices to make sure that they are safe for reuse and they do not pose a risk of infection, and they maintain their integrity after cleaning, disinfection, sterilization, storage, basically all the required process that they go. It's important that the devices maintain their integrity. Adhering to IFU is crucial for preventing healthcare associated infections and for maintaining the compliance with regulatory standards.
That is awesome. Thank you for that breakdown. Now, just a quick personal question before we go on. At what point in your career did you first get involved with IFUs, and why?
So when I started my career with manufacturing device company, so basically I got involved, but mainly I would say my role changed. And when I started the standard development and strategic planning for reprocessing guidelines, that was the time that I would say I've been more involved with IFUs around 2020, I would say.
Okay, good. That's good to know. Definitely appreciate that that input. So we all know, right? IFU implementation is definitely frequently a challenge for SPD staff. Now, in your opinion, what are some ways to make it easier for sterile processing professionals to implement them and to keep their patients safe?
Yeah, I totally agree. You know, one of the biggest challenges in implementing the IFU is the complexity and the variability between different devices that we have. On a single day in SPD, how many different medical devices they are dealing with, right? We have a wide range of medical devices made from various materials, and recently more complex devices with built-in electronics component in them, they have emerged and they've been added to the devices that are being used. So, and each of them, interestingly, they require specific reprocessing steps. So all of them, they make it really complex to implement. But there are some ways actually can help to make it easier for the sterile process professionals. I can focus on some of them. For example, standardization of the formatting. Simplifying and standardization of the formatting of the structure of IFUs across all different devices, can really help reduce the confusion. If we have a consistent format with clear sections that, it's cleaning section, it's a disinfection section, it's a sterilization section, depending on of course, the medical device, it allows the staff to quickly find the necessary information they need in the really quick time, basically. Another point would be, I would say, training. If it's possible to provide hands-on training that walks the SPD staff through the implementing of the IFUs, and it can enhance their understanding and compliance, and the real-time feedback during those training sessions can reduce can reinforce the correct procedures and reduce ambiguity. Another thing I would say, the digital tools, right? We are now working in the digital world, or we are getting there. Utilizing digital systems to store and organize IFUs can streamline the access. Then SPD staff can easily access some tools or features like barcodes. You scan a barcode when you need, immediately just scan it, and then you'll instantly you receive the right reprocessing instruction that can really reduce the manual effort and errors as well. Another point, the last point I would say, having a cross-disciplinary communication. And this communication, having a regular communication between SPDs, between infection preventionists, between device manufacturers, this really can resolve the ambiguities and also make sure that we are following the best practice, all, because basically we want to make sure that, do whatever is needed for patient safety.
Amazing. Definitely amazing. Definitely appreciate the breakdown and how important simplification and standardization of IFUs are. I mean, so many times we have a tray or a set that has different instruments from different vendors, and they have different instructions and different temperatures and modalities that are required. So it really is hard, but simplification and standardization of the IFU would make life so much easier. And definitely training. Yes, digital world, barcodes, so many different ways that we can keep track of things. And I learned this years ago when I first went into leadership, how important that cross-disciplinary communication is. Very important, and that's how you get things done. And so that's a good segue into the next question. So what do you think SPD staff should know about the process by which IFUs are written? Because I know so many times folks are saying, who wrote this? I know I've caught myself asking that same question. Who wrote this? So what should SPD staff know about the process?
It's a great question. We see the process, from our own perspective, and depends on, our roles that we have, right? I think it's important that, this process also that SPD staff also see this process from manufacturer point of view as well. The first point is that IFUs themselves are product, like medical devices. Like any medical device, creation of IFUs should go through a multi-step process with standards and design controls. It means collaboration across multiple teams, such as design team, human factors, risk management, product management, technical writing, regulatory, quality assurance, and so many other teams. In other words, IFUs are developed based on rigorous testing and validation processes conducted by manufacturer, because as a manufacturer, we are required to conduct these testings to ensure that our instructions, they lead to proper device performance and safety. As I mentioned earlier, the process involves input from engineers, regulatory experts, clinicians, sometimes sterilization professionals, and each IFU must comply with national and international standards as well, such the ones that's set by ISO, AAMI, or FD guidelines. So manufacturer conduct cleaning, sterilization, and all other reprocessing steps required based on their device, and also functionality testing. And we do all of these under validated conditions to create these instructions, which are then reviewed by our regulatory authorities and then external regulatory authorities. So understanding this is a very complex background that we need to go through just to create IFUs. I hope that this helps SPD professionals, that they appreciate some of the reasons why they had so many details a step that they need to follow while they're processing instruments and medical devices.
That is great to know, because I think this will definitely help this SPD professionals to truly understand what really goes into it. So that being said, can you tell me about your work with AAMI as it relates to IFUs?
Well, my work with AAMI has involved contributing to several working committees during the time, and I have joined several committee and working groups. But regarding IFUs, there's a group, Sterilization Working Group 12. This group focuses on instruction for reusable device reprocessing. And actually, as we mentioned earlier, I serve as a co-chair, one of the co-chairs for this group, and alongside my colleague and my friend, Mr. Damian Berg, who is another co-chair, and he brings valuable experience from the end user perspective in sterile processing. And both of us, we are co-chairing this working group. And in my role, I work to align industry best practices and regulatory requirement with a strong emphasis on ensuring that IFUs are clear and are helpful for the healthcare professional. It is crucial for maintaining high safety standards and the SPDs. And I often emphasize that the need for IFUs to follow what I call 3 Cs. They should be clear, concise, and compliant. So clear IFUs help professionals understand instruction easily. Concise IFUs ensure necessary steps are outlined without unnecessary complexity, and of course compliant, because we have to meet all regulatory standards.
Clear, concise, and compliant. That's great. Those are great acronyms that I think we could all live by. CCC, right? So even with that being the case, what do you feel is the importance of having sterile processing folks in the room when these IFUs and related documents are written? And if not in the room, having them review prior to them being pushed out to the world, so to speak.
Perfect. Very great point. I think I mentioned earlier, manufacturers, sometimes they may gather end user input at various stages that they are doing product design. So they make some working groups or task groups, and they reach out to some end users. They get their impact. They seek their input, and for IFUs as well. However, this is incredibly invaluable, but it's limited. We all know that we can only reach out to a small number of end users. They can get this opportunity to participate. And simply, it's not feasible for a manufacturer to seek input from all users, right? So how to get involved? It's very important that a sterile processing professional get involved in development of IFUs or related documents in platforms like at what AAMI provides. We have standards that they are, or technical information, TIRs, or other documents that they influence the IFU creation. So it's very important that get involved in any opportunity they get. If they get opportunity from a manufacturer to be in those, selected end user to give feedback, of course. If it's not, then these platforms that's provided by AAMI, so they can basically give input, because they are the ones who will ultimately use these documents. They are the end user. They will basically, their real world experience provides insights about the practical challenges that they face in SPD in daily basis. They assess whether this instruction are really clear for them, if the steps are unrealistic or realistic in their busy clinical settings, whether their necessary equipment and resources are available or not in the healthcare facility. And this information they provide, I said, either in those product design stages that they get involved, or in this standard settings that we are developing documents like to IFUs, creates a very valuable information to help improve the IFUs.
Thank you for that. And you mentioned Damian Berg with the last question, but then in this instance, immediately he popped up into my mind, because I've been knowing Damian for years. And when I first got started in the industry, he would always say to me, and he says it to everybody, you got to get involved. You got to get involved. If you don't get involved, nothing's going to change, right? And so, yes, getting involved is very important. Other than that, right, it's kind of like, putting your head in the sand and waiting on something to happen. So that's something that always stuck with me, that he would say, get involved, get involved. And that was even prior to me getting involved with the AAMI groups. So what about other constituencies, like such as industry or regulators? What's the importance of having those groups at the table as well, or reviewing IFUs?
So I mean, it's definitely a teamwork. It's definitely requires collaboration, and it's equally important to have industry representative and regulators alongside end users in development instructions for use, or IFUs, because industry experts, they bring their in-depth knowledge about the device, about their design, about the materials, about the testing protocols that they've gone through. So they know everything ins and outs about the product. And then and it makes sure that these IFUs are scientifically sound and technically correct and accurate. That's from the industry side. But what about regulators like FDA? They have a key role because they ensure that IFUs meet the required standards for public safety. Their environment ensures that IFUs comply with legal and regulatory requirements that needs to be followed. So making the instruction both legally enforceable, also safe for patient use. And regulatory bodies can help in aligning the contents with the public health goals and basically meeting the efficacy standards. So collaboration between all the stakeholders, including industry, regulators, and end user, is necessary to make sure that the IFUs are practical, safe, and compliant.
Thank you. Is there any upcoming work with AAMI related to IFUs that our audience should know about?
I would say great question and perfect timing. You know why? Because AAMI Sterilization Working Group 12 is actively revising a document. This document is titled as Designing, Testing, and Labeling Medical Devices Intended for Processing by Healthcare Facilities. So let me mention this. This guide is primarily for manufacturers, for device manufacturers. But we talked about earlier, right? We strongly encourage all the stakeholders, especially end users like sterile processing professionals, to participate in this process. You mentioned, right? Damien Berg mentioned just join, and I second that. It's a great opportunity for end users to provide their feedback, share their real-world experience, which can significantly improve the usability of the guidance. So for people who are listening, who are not already part of this working group, I highly recommend get involved. If you're interested, just contact AAMI. They're great. They will get back to you very quickly. You can join AAMI and this working group specifically, so that and the document is open for comments. And we are going to review and discuss these comments during the upcoming AAMI Standardization Week in March. So it's a great chance for those who are passionate about IFUs and patient safety to come join and contribute.
Atila, you beat me to the punch because I was going to ask you how an individual could get involved. So thank you for sharing that information. Well, folks, I hope this episode has been useful, and we'll be back in 2 weeks with another episode. Now, if you want to support the podcast, you can find us at Below the Hospital on Spotify, Apple Podcast, YouTube, and AAMI Array. Until then, we are signing off. Atila Nozari, thank you for answering those difficult questions for us.
Thank you, and have a great day, everyone.